And thank you, Chairman Murray, from my Budget Committee. We are still recovering from the worst recession of our lifetimes and a foolhardy shutdown. A harmful budget sequester is eroding our economy, and a debt limit once again looms. So we have serious work to do. In poll after poll, Americans have been clear that the most urgent issue facing their families is the weak economy and a lack of jobs. Unfortunately, federal budget policy in recent years has been dragged down the dangerous austerity path and largely ignored the role that, for instance, infrastructure, research, and energy efficiency can play in supporting our economy and jobs. Europe's austerity experiments inflicted significant economic harms while not delivering the promised budget improvements. At home, the dangers of austerity budgeting show in the sequester, which, to its credit, was designed to be stupid and painful and has filled that bill. In August, I heard from Rhode Islanders about layoffs in the defense industry, civilian personnel forced to take unpaid leave, children unable to enroll in Head Start, and a cruel $40 a week cut to unemployment insurance while my state is still hovering around 9% nominal unemployment. Actual unemployment, as Bernie's pointed out, much higher. But we also heard about more lasting damage. Karen Markin is the Director of Research Development at our University of Rhode Island. She said, I'll quote her, "These budget cuts are insidious because we won't feel the consequences for a few years. And when we do, it'll be subtle, but devastating in the long run. It will be the absence of innovations in science, technology, and medicine at the pace we've come to expect. It's like deferred maintenance. It seems innocuous now, but it will come back to bite us several years from now. We can probably recover from a single year of treading water in scientific discovery, but if this keeps up, the nation's scientific research enterprise will begin to erode. And China and other nations are not going to step out of the competition while we inflict this damage on ourselves. We must replace the sequester with policies that support job growth. Our efforts to date have been heavily in the form of spending cuts. Of the $2.5 trillion in deficit reduction since 2011, cutting spending on government programs has been $1.5 trillion. Additional revenue has been only $600 billion, and the difference has been interest savings. What has been at zero through this entire exercise is another costly area of federal spending. We have done nothing on federal spending through the tax code. I say to all of my fellow conferees, you cannot honestly say that the debt and deficit are mortal threats to our nation and at the same time less important than every tax loophole in the code. That cannot be our position. Our Senate budget generates $975 billion from loophole closing, and I'd urge everyone to take an honest look at this untouched form of spending, tax spending through our tax code. The tax loopholes I'd like to devote to deficit reductions are ones we should get rid of anyway. Big oil does not need taxpayer subsidies. Companies should not be rewarded for shifting assets to foreign countries. Billionaires should not pay lower tax rates than brick masons. Correcting these flaws would be fair and help us create jobs and grow the economy. I'll close on health care. The potential savings from health care delivery system reform are enormous. Experts from the President's Council of Economic Advisors to the Lewin Group and former Bush Treasury Secretary O'Neill to the Institutes of Medicine estimate $700 billion to $1 trillion a year in nationwide health care savings, without compromising health outcomes, likely by improving the quality and experience of care Americans see, addressing things like medical errors and our backwards payment structure. Since over 40% of total health spending is federal, that means huge potential federal savings. In fact, according to CBO, progress has begun. Since 2010, when the Bowles-Simpson Commission recommended we cut our deficits by $4 trillion, we've seen CBO's estimates for Medicare and Medicaid drop by $1.2 trillion, substantial savings that have not been included in the official deficit reduction tallies. So I look forward to working with conferees on both sides to support policies to deliver the savings and better health care Americans deserve.